is at Laval University. He joins us right now in Montreal. So thank you for joining us today.
Thank you for having me.
So, for people at home, you run a lab where you and your team are investigating several vaccine candidates. Just how close are we to seeing a vaccine for COVID-19?
Well, to make the vaccine, that's the easy part, so to speak. It's quite fast, actually. We have several that are now advancing in preclinical, and one of them should be entering clinical study trial this month, actually, in a few weeks, pending FDA approval. But that's just the beginning. What takes a lot of time is to accumulate enough data in terms of potency and safety before we can make those vaccines available to the public.
So how quickly can that happen then, to accumulate the data that you're talking about?
Well, during the West African outbreak of Ebola virus, it took 18 months, roughly, from phase 1 to complete the phase 3 clinical trials, which is the last step. Still, the vaccine took an additional 3 years to 4 years before it met all the requirements by the regulatory agencies to be licensed. So it means to be made available publicly for country to buy. But this time, I think that there's even more global support. There's a lot of support in Canada at all level of government. So I could see this 18-month being shortened we're trying to get all this done within 12 months. We'll see if that works. It's not only depending on us. There's a lot of layers. Regulators have a very important part, and they are there to protect the safety of Canadians. And so we have to work together to get as efficient as possible, but to also deliver products that are safe.
Mm-hmm. Deliver products that are safe. But once a vaccine or vaccines have been developed for this, how would they be administered?
It depends which vaccine you're talking about, but most of the vaccine are still an intramuscular injection. Vaccines are a bit better in the intradermal space, so I like the rabies vaccine. But the injection itself is as the other vaccine. As for the reaching out to people, I think when we get there, we'll have plenty of time to organize vaccination site between now and then.
Mm-hmm. So the vaccine still about 18 months away if they were to speed up the process. And I don't know if you can answer this question. Are there any intermediary measures, though, ahead of a vaccine? What's the discussion of perhaps finding like a Tamiflu version that would take on COVID-19?
Yeah, so this is more a molecule, a treatment that could be taken including prophylactically, so which means that you could have a treatment. So a vaccine is to to protect somebody from acquiring disease. A treatment is to treat somebody that is already sick. But some of those molecules can use product, which means that you protect yourself from being infected. For now, there's a lot of interesting molecules that are being studied. None of them, for now, have a very strong backup to say, okay, this works for sure, 100%. We don't have that yet. But there's a lot of good candidates that are being studied all throughout the world. And I'm quite confident, actually, that we'll at least have something that, improve the outcome. Even if it's not the miracle treatment, I think it's likely that we'll find some molecules that will improve outcomes.
Okay. Well, in the meantime, we wish you well in your research. Thank you for this, Gary.
Well, thank you.